This is Dave Hosfeld with Encore, the talk show for seniors. Welcome back to Navigating the Healthcare Maze. Who do we have with us again today?
Dave, we have Elizabeth Concannon, an insurance advisor.
Elizabeth, welcome.
Thank you.
I understand you're going to talk about Part C today.
I definitely will.
I'd like to know what Part C is and how one qualifies for Part C.
Yes.
Sure.
Can you tell us that?
You have to have Medicare Parts A and B. They have to be effective. And actually, you have two options. After Medicare, the original Medicare, you have option one, which is the Medigap or Medicare Supplement. Option two is Medicare Advantage or Part C. What Part C is that it's just A and B kind of rolled together to make it into a C. And sometimes it includes prescription drug plans, which is called Part D. You confused enough? Some companies will actually offer some value-added services like routine eye care, podiatry services, annual physical exam at zero copay.
That's in Part D?
That's in Part C.
Part C.
Part C.
Oh.
Yeah.
And those would be known as riders, is that correct? Those
the
added features.
The dental
Yeah.
and
the vision and those kind, hearing and those kinds of things. Now, can you explain more about, can you get a standalone Part D?
Good question.
Yes, you can. That's a great question. A lot of the seniors are probably still on the original Medicare
Right.
with the Part D. And
Right.
I'll tell you why people are actually enrolling in Part D. After they are eligible, or when they're eligible, they have to enroll in Part D. Otherwise, they're going to get a late enrollment penalty.
And they have to pay a fine?
They have to pay a fine, yes.
Oh, for
it's not
goodness
very
sakes.
much, but it adds up. You know, for somebody who's not had Part D for 5 years, that can be a lot of money when they do decide to buy the prescription drug plan later.
You've talked a lot about Medicare with us, and although it's been enlightening, I do have to say I'm still confused, and if I'm confused, there may be more people out there, our audience members, that may be confused about this.
I get that a lot.
Yes. So what I'd like to say, if you would like to get a hold of Elizabeth, you can reach her at our website at www.encoretalkshows.tv.
I hope that you will come back and explain to us the difference between Medicare and what's called Obamacare.
Oh, yes.
Or affordable health care.
ACA.
I'm happy to. Sure.
Wonderful.
Yeah, that is part of the confusion nowadays.
It is a lot of confusion. We'd like to thank Elizabeth for joining us today. It's been a lot of fun. We really appreciate the great information that you gave out.
I appreciate it a lot as well, but as a person that's working in the healthcare industry, I know that I work with seniors that still have a lot of anxiety. And I wanted to know, just briefly, how you can address some of the anxieties they may have here, and then Dave will tell us how they can then access the information
Oh, yes,
on our
please
website.
do. Tell our audience, if you would, please.
Well, you know, I meet with a lot of clients, especially this open enrollment period. Actually, I met with an 83-year-old in Livermore just this week. He is paying $800 a month on his plan. And, you know, he just kept paying it, not really questioning it. And I came in, explained the same program, and I got it down to about $245.
Wow.
Oh, what a blessing.
And it's, yeah, I mean, you know, and if you're in that situation, you know, find somebody, find an agent, call a company, you know, do something. Don't just pay something that, you know, that you can actually, you won't have to.
It pays to act.
It does.
And
yeah.
Elizabeth is encouraging you not to be afraid to ask. That asking questions can save you money.
Exactly.
Indeed.
And that's a big thing, a big area of fear for our seniors
Yeah.
Right.
is their income. I would imagine spending $800 a month on
That's
insurance
crazy.
that
He
he
doesn't
might
have a lot of money.
that he might have a hard time paying for medicine or other things that he might need. So, yeah, it definitely pays to get our series.
Yes, it does.
Yeah.
Elizabeth, it's been great having you. And folks, if you need to contact Elizabeth, you can reach her directly through our website at www.encoretalkshows.tv. That's encoretalkshows.tv. Elizabeth, thank you for being prepared and giving us great information on the healthcare maze.
Thank you.
You're welcome.
Folks, this is Dave Hosfeld with Encore, the talk show for seniors, and we just want to let you know, if you're going crazy watching TV and trying to figure out Medicare, we've got the person for you, and you can reach her 24/7 on our website at www.encoretalkshows.tv. And that is our mini-series on navigating the healthcare maze with Elizabeth Kekanaden.
Yes.
I felt like I lost you all of a sudden.
No,
You
no, I'm-
went away somewhere. Okay.
I'm gone.